me begin introducing Jim. Jim is the West Virginia Hospital Association President and CEO. He has nearly 25 years of healthcare experience. Prior to joining the West Virginia Hospital Association, Jim served as Vice President of Public Policy for the Children's Hospital Association, representing over 220 hospital organizations and pediatric programs dedicated to improving child health through innovation in care, education, and research. At the federal level, he has worked on higher education reauthorization, state children's health insurance program reauthorization, Medicare physician payments reform, funding for embryonic stem cell research, Medicaid, the National Institutes of Health reauthorization, and numerous appropriations. Jim joined the West Virginia Hospital Association in November of 2020, and we are glad to welcome you today, Jim. So the program is yours. Thank you for joining us and welcome.
Steve, thank you very, very much for the opportunity to present. Just wanted to give a little bit of an overview about the hospital. So hopefully you've heard several great presentations this morning already about, the impact of COVID on heart disease or the overall efforts of the communities working together to respond to COVID. What we'd like to do is just kind of give you a little bit more of a broader impact about the hospitals. And we figure out, there we go. And just give a quick snapshot of the hospitals in West Virginia. First of all, we have about 59 members that are members of the West Virginia Hospital Association. The only members we don't have, there's a handful of hospitals out there. They're mostly the state hospitals and a couple of the Veterans Administration hospitals that are not members. But when you start to think about hospitals around the state, basically in the 55 counties of West Virginia, we have a hospital in 37 of those counties. Now, what's important to note is when you think about it, usually your hospital is a pillar of that community. Not only are we the largest employer, directly employing 49,000 West Virginians and accounting for a huge amount of economic activity across the state, such as $11.6 billion in annual activity, we're also really important to helping attract other families to a community and other businesses because people want to move to a community that is strong and vibrant, and hospitals play a critical role in that piece. Now, kind of giving you a high-level overview, one of the things that's important to remember is when you think about healthcare coverage, the pie chart on the left shows where West Virginians get their health insurance coverage. And you can see when you talk about employer-sponsored coverage, this is the health insurance that most businesses provide their employees. Overall in West Virginia, we're only talking about a third of the state receives their health insurance coverage through their employers. What's important to note is the vast majority of West Virginians, about 60%, receive their health insurance coverage through governmental programs such as Medicare, Medicaid, or PEIA. And just give you a quick snapshot for those that are not familiar, Medicare generally is for those over 65. Medicaid is the government program that's federally and state administered that is really targeted towards either low-income individuals or those with comorbid conditions or disabilities. And then PEIA is the state insurance program for its state employees. Now, when you think about coverage, it doesn't always equal exactly utilization on healthcare. And the pie chart on the right shows where hospitals are receiving most of their reimbursement and the patients that they're caring for. And what it shows is the vast majority of patients, not surprising, treated at a hospital is covered by Medicare. But what's really important to note when you think about Medicaid, Medicare, and PEIA, that's about 75% of the patients that we're serving are covered by those three governmental programs. Now, the reason I want to point that out is because when you start to look at the reimbursement piece, this is a major issue for hospitals. As the bar chart shows, usually when you're looking about the cost of care, the average cost of care is higher than Medicare, which is the reimbursement rates are set by the federal government. Medicaid reimbursement rates are set by the state as well as PEIA. And as you can see, they're significantly below the cost of care, which is one of the reasons why commercial insurance is actually paying more to help subsidize or cover that cost shift because of the lack of payment from the three governmental programs. Now, just to give you an idea, that underpayment between Medicare and state programs, Medicaid and PEIA, in West Virginia accounts for about $575 million last year in under reimbursement due to the cost of care. Now, the reason we point all this out is hospitals are actually at a tipping point. Our financials are very, very strong, challenged. As you can see from this line graph, this is comparing the average West Virginia hospital margin compared to that of the nation. And as you can see, usually we're 2 to 3 percentage points below the country's average margin. Because of COVID, we've actually seen our margins hit below 3% this year. And that's accounting for about a $400 million shortfall due to increased COVID costs, due to increased costs, lost reimbursements. And what's important to note is that $400 million number is actually accounting for funding that we received from the federal government to help try to deal with the COVID shortfalls and some of the challenges that we've been facing. I point all this out because as we are noting, we are at a tipping point. Prior to COVID, you actually saw hospitals in West Virginia close or file for bankruptcy. If we don't address the long-term economic viability of the hospitals, we may see more closures, more program cuts, or non-clinical staff reductions. And I think that's something important to be aware of as we're looking at the future of West Virginia, how we're trying to attract more families and individuals to the state, more businesses. People want to move where there's a strong community, and hospitals are a part of that. So as I mentioned, I just wanted to give you kind of a quick snapshot of some of the hospitals where we sit and some of the challenges that we're facing. So with that, Steve, I'll turn it back to you and open it up for any questions if there are any.
Would it be okay to email them to you and then go ahead and get them back to our attendees that way?
Please do. Anybody can have a question. The team here has my contact information. You can just reach out to them and they can send either my contact information directly to you or send them your question and I'll get back to you directly.
Okay. Well, Jim, again, thank you so much for being here with us today. And we look forward to continue working with you in your new role up at the West Virginia Hospital.